Hi, I'm Senator Tom Harkin, and I want to talk with you about some really exciting news that's just happened here in the United States Senate on Wednesday, July the 15th. This morning, the Senate Health Committee, of which I am a senior member, just voted out the new health reform bill. This is a bill that's going to do at least four things to reform our system. One, it's going to reduce costs for consumers and for all the people out there that don't have health care insurance. Secondly, it's going to protect your choice of doctors and hospitals. If you like your doctor, you like your hospital, you won't have to change. And if you have a health care plan that you like, you don't have to leave that health care plan. Third, it's going to assure coverage. It's going to assure coverage for all Americans with no thought about pre-existing conditions. It'll be fully portable, and we'll have a public option plan in there so that if none of the other plans suit your needs, we will have an affordable public option that will not be based upon a profit motive or anything like that, but basically giving good health insurance to everyone. We call it the Affordable Health Choices Act. As I said, it just passed the Senate this morning, passed the committee this morning, and we will now be taking it to the Senate floor. Now, one of the most important things we've done in this bill, and one that I worked hardest on and I was in charge of formulating, is provisions on prevention and wellness and public health. I've said many times that in America we don't have a health care system, we have a sick care system. If you get sick, you get care, one way or the other. And that's what's costing us so much. We put everything on patching, fixing, and mending after you've become ill. But we don't do enough to keep people healthy and out of the hospital in the first place. When 75 to 80% of our healthcare costs are attributable to 4 or 5 chronic diseases, most of which are preventable, then it seems wise to me that we should be putting more on prevention. Well, we're doing that in this bill. This is really going to shift the way we do healthcare in America, because we're going to be putting more into making sure that if you want to have a checkup, you can do that without a copay or without deductibles. It also means that we're going to be focusing on community wellness, on nutrition counseling, anti-smoking programs, and also workplace wellness, encouraging employers to have workplace wellness programs for their employees. President Obama has said it time and time again. He said, if we really want to reduce healthcare costs in the future, we've got to focus on prevention and wellness and keeping people healthy in the first place. That's what I'm really proud of in this bill. That's what I worked very hard on, and that is a real centerpiece, I believe, of this legislation. And so now we move ahead to the Senate floor. I hope we can work on it diligently. I will say this, in committee, we spent over 13 days, 23 sessions, over 54 hours, some of those late at night, working to get this bill through. And so we're well on our way to meeting President Obama's goal and all of our goals of reforming the healthcare system in America so that no one's left out, so that everyone has adequate coverage that is affordable, that is quality, and that focuses more on keeping you healthy and keeping you out of the hospital in the first place. So the next step, well, the Senate floor. We'll be working hard there to bring this bill through and hopefully have it on the President's desk, well, I hope by October. Again, this is Senator Tom Harkin, and if you have any questions or suggestions, thoughts on this very important, vital issue confronting us, health care reform, please, by all means, let me know and let my office know. If you see things in this bill that you think we need to change or modify, by all means, get in touch with me and let me know. And again, hopefully we'll get this done and on the President's desk by October. Thank you.